Welcome to the Cultivating Health Equity Stories podcast. In this captivating series, we delve into the heart of health equity, sharing stories that illuminate the path toward a fairer, more inclusive healthcare landscape. Our mission is to amplify voices, challenge norms, and inspire change. Here is your host, Dr. Troy Campbell, a research scientist on health equity issues.
Today we speak with a champion of social health, Dr. Carmen Harris. Dr. Harris is a passionate nonprofit leader and professor at the University of Texas at Arlington, committed to driving positive social change. With over 20 years of experience in the nonprofit sector, she has dedicated her career to empowering marginalized communities and addressing social disparities. Dr. Harris, I am looking forward to our conversation. Welcome to this podcast show.
Thank you. Thanks, Dr. Campbell. I'm really grateful for the opportunity to talk with you today and explore this topic, very near and dear to my heart.
Right. Thank you. And we can go straight into our conversation then. You know, you have a deep-rooted desire to make a difference. And tell us about your journey. You have an impressive background of about 20 years of experience in the nonprofit sector. So could you share how you got started and what motivated you to dedicate the greater part of your career to driving positive social change?
Yeah, thanks. Yeah, definitely. Well, from humble roots, for sure, growing up in rural East Texas with family and community that sometimes lacked, for different things. And, as I grew up, I think our family and the community at large was just always sort of wired for serving others. And, we always looked for opportunities to do that. I somehow made my way to Canada and was able to land in Toronto. I mean, one of the most diverse cities in the world. And, well, in that place, seeing a lot of opportunity to serve. And so being able to work in a variety of contexts. I started my nonprofit career with Canadian Baptist Ministries, which was an amazing opportunity to do some things globally and see what was happening around the world in terms of, health, economic factors, education, resources and needs. And so moved from there to an organization called World Vision and took a lot of that learning to kind of explore what it looked like in our own backyard in the Toronto area. And so it was a great opportunity to explore a lot of things and start to see, from a variety of ways and cultures, what does health equity look like? Right. What are the resources that are sort of driving health, both positively and negatively, and working on program implementation plans, and community development activities to try to do some good. Right. And I was really honored to be able to do that. And then after about 18 years in the Toronto area, came back to Texas, where I'm from, and worked for an organization called Mansfield Mission Center to continue some of that work.
Nice. Most people who moved away from Texas return to Texas. After 18 years in Toronto, you come back.
Might have been part of that.
I was going to say you come back to warm Texas. Yes. Yeah, and we're going to go into some of the details. But I know you studied in this field some too, and you were a professor at UTA. So can you tell us a little bit about that leg of the journey?
Yeah, kind of how I ended up doing that. Well, I finished my doctorate kind of with the aspiration of teaching and retirement at some point, and an opportunity presented itself that I just couldn't pass up to go and teach full time. Prior to that, I finished my doctorate looking at the non-medical drivers, the social determinants of health, and was able to apply that at the Mansfield Mission Center. I was there while I was doing my research and my dissertation. And so I used the organization as a case study, thinking about healthcare and what it means to the community. And so asking important questions. And so finishing that dissertation then allowed me to go to UTA to teach full time. But, it was certainly a journey kind of getting there, but, certainly privileged to have had the time at the Mansfield Mission Center and looking at, what it means to do healthcare holistically for folks that don't have insurance, practically speaking, in this area.
Right. Well, you've said a lot there. I'd like to probe. I'd like to talk about you and your students teaching this generation about nonprofit and so forth. And then you just mentioned, providing insurance in the community. Let's talk about empowering marginalized communities. What strategies or approaches have you found most effective as someone who has, successfully implemented programs to empower marginalized communities? How do you ensure that these programs address these unique needs? A very compact question I ask. I understand.
Yeah, it's a good question. It's a big question, but a good one. Texas is the most medically uninsured state in the country. And so the needs are great. And the only way I think we can effectively implement change is through collaboration and partnership. Not one organization can be all things to everyone. And so I think it's really important to not only get to know the community. I mean, you start with that first and foremost and trying to figure out, what are the community's needs? What are the individual's needs?
Right.
We're all experts in our own health, in a lot of ways. And so I don't think we can make assumptions about what one individual's goals might be.
Right.
So figuring out, based off of, their health and having those conversations, what are their goals? And then what does that look like more broadly within the community? And in this area, it's going to be things like diabetes and hypertension, particularly for folks who are uninsured. Both of those issues are very expensive to treat and a little bit complex. You need a lot of things outside of just medication. You need nutritious food, you need access to exercise and a lot of different things. And so not one organization can do that well on its own. Right. And so collaborating with different entities and bringing partnerships together to be able to provide a comprehensive strategy, I think is just really important.
How do we do that? Community organizations that seek to do this good work tend to not be as resourceful as they wish. Then you have many organizations, small organizations within a community, like the Metroplex we live in, the Dallas-Fort Worth area. How important it is to have a system of collaboration that allows them to collaborate, or somewhat of a hub I can think of. What's your take on that?
In an ideal world, I think that would happen in most communities. I think where the challenges are, smaller community-based organizations, you're so busy trying to do so many different things. It can be very difficult to take the time out to try to carve out that space for leaders to come together and have those conversations. And then you have to educate donors, and that becomes tricky at times where you've got well-intentioned, donors who feel like that they want to invest in a very specific kind of activity, but not necessarily being on the inside and doing community development work every day to know, hey, maybe we should be spending our dollars differently to get a greater impact. And I think those are the conversations that leaders need to be having, on an ongoing basis around the table. Okay, what are those collaborative strategies that we could do together?
Right.
And then how do we educate the community, the donors, the churches, all of those philanthropic people to understand if we could create those resources collectively, we could have an even greater impact. So it's multi-pronged, I guess.
It is. And I think a donor typically wants the greater part of the dollar to reach the community. However, I think, as you've said, the conversation, we need to have the conversation regarding perhaps the expertise that's needed within these missions and associations. It's important to invest in perhaps an education system, educating those who work and try to get. Can you talk about that? Yeah, it's a whole lot.
Yeah, spot on. You know, I believe in doing things with excellence, and I believe that we owe it to the communities that we serve. I
Right.
don't think we should be doing things as cheaply as possible because you get mediocre results,
Right.
unfortunately. And
Right.
I don't know how we go about educating people in a way to let them know in order to create impact and to honor the people that we're serving, that requires resources. So it's more than just, you know, how many pounds of food are you distributing, or, you know, how many vaccinations did you give away? It's what are the innovative things that we're doing together to really drive change, that
Right.
nobody else is doing,
Right.
and those require some big conversations, leaders to come around the table to have those conversations, and for donors to come in, whether that's technology,
Mm.
facilities, you know, collaborative transportation services. I mean, it could be a variety of things.
Right. You know, Dallas Fort Worth area, which includes Mansfield and Arlington and so forth, is increasingly diverse. People from all walks of life with different languages.
Hmm.
How do we
Yeah.
address that? I think it's so important for community associations to be equipped
Hmm.
with the resources to reach
Hmm.
people who speak different languages, who have different health practices and behaviors.
Yeah.
You know, what?
Yeah, I mean, and I saw that in the research during my dissertation, you know, the secondary research, as well as the interviews that I did with volunteers that were at the clinic. You know, when the provider or the nurses don't speak the same language as the patient, they don't spend as much time because it takes more time to be able to get the information you need. Those folks that I interviewed said that it was challenging personally for them and frustrating at times. And so if you're not spending as much time with the patient, you're not understanding the full picture of what's going on with them.
Right.
So you could be having a conversation with someone who's diabetic and you're struggling to understand why haven't they made the dietary changes? How come they're not getting the exercise that we've recommended? And so going through those conversations, if you're not able to get at the heart of the issue because of the language barrier, or even culturally with
It-
food. I mean,
right.
you know, like if you don't understand the dietary preferences and the eating patterns, the eating habits, you're not able to make those appropriate subtle swaps or
Right.
dietary recommendations. So providers get frustrated because they don't see the patient making the change. So then at points in time, they stop making those recommendations
Yeah.
because the patient's not following up on it. And they think,
Right.
well, it's lazy, or if the efficacy is there's a gap on the patient side, and
Yeah.
they're not recognizing that it could actually be the person who's making the recommendation, nurse, doctor, whatever, that's not educated or equipped. They're just not equipped.
Right.
And so I think there is a conversation on a broader scale to figure out, is it cross-cultural training? Is it cultural humility? You know, how do
Yes.
we figure out how to bring these folks along that they're serving a different population than the one that they may normally see typically, you know, in their own private practice.
Right.
And I think that's across the board. I think our hospital systems would say that, you know, whether that's
And,
an emergency room,
and
diabetic patient coming in on an ongoing basis, you know,
yeah.
and they're seeing these repeat patients, you know, and they're lacking in the an awareness or the resources or tools to be able to serve well.
You know, you and I can speak this research language. You know, research suggests that it takes up to the third generation for the person to be completely acculturated to a community.
Mm-hmm.
Say, you know, you are a first generation American, the chances of you accepting health practices and beliefs within the American system
Mm-hmm.
is unlikely, you know. So it takes your grandchild to be fully acculturated because you come in with different beliefs, different
Right,
practices, you know.
right.
What takes away your fever, your what you would do back home is different from what you would do here. The
Mm-hmm.
idea of certain medications is just not what we're used to. And
Right.
there's also a spiritual aspect to it. I might not have the expertise to get into that,
Yeah.
So it's huge. It's a huge struggle. Culture is I think is deep,
Hmm.
but something if approached, if the right approach is taken, will make a huge difference
Hmm.
in how receptive patients will be to providers' prescriptions,
Hmm.
treatments that they suggest. Anyway, so we clearly culture cuts across everything. So let's dive a little deeper, perhaps, on social determinants of health.
Hmm.
Your work at the mission, Mansfield Mission, and other places
Hmm.
address social determinants of health, of course. So can you elaborate on a specific initiative you led to
Hmm.
improve health, whether in Tarrant County or a previous
Yeah.
community?
Yeah, I think one of the most collaborative programs that I had the opportunity to be a part of was called Work Well.
Yeah.
And it really started with a conversation from a local business owner in our community who had noticed a pattern where they were hiring people to come and work in their, like a plant, kind of factory environment.
Right.
And coming out of COVID, there had been a number of people who had been unemployed for a while. And so what they were seeing was during COVID, people were getting, supplementary income, but maybe not access to healthcare needs. They were hiring some new folks that hadn't been treating whatever an existing condition was. And so they asked, what could we do to try to like bridge the gap between having a new hire and them getting access to medical care? And I'll give you a specific example.
Yeah.
There was an individual that was hired to go and work in kind of their evening shift. Great opportunity for this young guy to come and get a great paying gig. He had been out of work for a while and was very excited, interviewed very well. They hired him. So during the onboarding process, they went through a series of things that they did. And one was an eye exam because it required a lot of kind of fine tuned things, with your hands and a high attention to detail. And he failed the eye exam. And so here's this guy about to get this great paying job with benefits, and they weren't able to hire him or fully onboard him because he needed eyeglasses. And so they reached out because we'd been having this conversation to say, hey, is there something that we can do? And so it was a great example of how, one small thing, this person knew that they needed eyeglasses, but they couldn't afford them. They were waiting for a great paying job with benefits to kick in, to be able to do that. And so we were able to create this program called Work Well, which provided stopgap health insurance for their new employees. So for that first 3 months, those employees didn't have to worry about primary care or glasses and things like that they could go to the clinic and be able to get those things. And, it was just a remarkable testimony to see how one
That's
small
nice.
thing like that can be, it creates an economic impact, not just for the employee, but for the community. I mean, this is a company coming out of COVID that was really anxious to make some new hires and get back, off the ground. So
We can't overemphasize how important it is to
Mhm.
make to provide health services. It has ramifications up and down
Yeah,
the line.
absolutely.
Yeah.
Mhm.
You speak of that example with providing health
Mhm.
insurance and so forth temporarily, and it drags my memory back to the time of COVID and how difficult it must have been for missions like Mansfield Mission and others to work during COVID time.
Mhm.
And I thought of mental health as a
Mhm.
big problem during the time. Do you recall anything that was done and how you worked through perhaps the time of COVID and
Yeah.
afterwards?
Yeah. Well, definitely during, kind of across the board. Our organization did a lot of work to try to find healthcare resources to help people with their mental health needs during that time. We did a couple of new things, which was creating a chaplaincy program so that we could have, folks come on staff that could be trained and work with volunteers who could be able to do that as well. Great partnerships with both the hospital networks, Methodist and Texas Health, who invested in that, both financially and with their volunteers. But, there was a really specific thing that we did as part of a community that sort of put us on a new path. So there's a national thing that happens every year called the National Day of Prayer. And so volunteers, church leaders, different folks from across the community will go out to different grocery stores and different points, just to interact with people who live in the area and ask them about things that are going on in their life, kind of get to know them a little bit. And ask, are there specific things that we could be praying for you about? So it's a great opportunity to meet people and then kind of get a glimpse, into what people are kind of working through. I learned so much about the people who live here, people who are grieving, a lot of people who had recently experienced the loss of a loved one, a terminal illness diagnosis, job loss. A lot of people who recently moved here, brand new to the community. And so coming out of that, I started wrestling with this kind of idea, we've got a lot of resources in the Mansfield area, but if you're new here, how would you even know?
How would you? Right.
To where to start? And so I started asking some questions and hearing different things, whether it was from partnerships with our police department who are just dealing with mental health issues in the community on an ongoing basis, social workers at the hospital, guidance counselors at the high school, chaplains at our hospitals. So we eventually started bringing people around the table to explore what are the most prevalent things that you're noticing here in the community. We had some focus groups. We did some stakeholder interviews. And one of the most prevalent things that did emerge was trying to figure out how do we help people access these non-medical drivers of health resources, particularly around mental health. So that was kind of a key thing.
That's so unique. And I wish there's a way to continue. You mentioned the chaplain from the hospital, the social worker from the hospital system, the pastor, the member of a church that's willing to help. All these organizations have different ways of collecting data on the state of the community or on the needs that exist in the community. But how do we centralize that? How do we ensure that that data is always available, and so the resources are going to the right place? And earlier we talked about donors understanding the system that we need to invest in to get the biggest bang for the dollar.
Yeah, absolutely. We did some research, and there are some platforms that across the DFW that you can get on to see that are more like social service agencies, whether that's nonprofit entities, NGOs, other community-based organizations, and even state and federal funded programs.
Right.
But there are so many more resources in the local community that don't have access to those platforms. I think one of the biggest strengths that the Mansfield area has is local churches. So many local churches have great resources, but people don't know about it if you don't go to that church.
Right.
And so we created a strategy around a concept called Wellbeing Mansfield.
Yeah.
And we started looking at the technology, and we created a website and a portal where local organizations and churches would be able to have all of that information in one place. So if you're a resident of kind of the Mansfield area, kind of the Mansfield ISD area, you could find the relevant services for you.
In one location.
Yeah, in one spot.
One spot. That is so cool. And I like the idea of I like the role that churches play, because perhaps because of their spiritual approach, they tend to be more culturally sensitive. They tend to be, and community members perhaps are willing to open up to their spiritual leaders and share with them exactly what their challenges are. So I just think churches play a huge role in helping the community, of course.
I think you're absolutely right from a cultural perspective, from a language perspective, whether that's churches and other faith communities more broadly, there is a great opportunity there. And so in that research, we started looking at ways that we might be able to do some training, cultural sensitivity training, mental health first aid training
Mhm.
for people in local churches, hospital frontline staff and things. And our mutual friend, Desmond Hay, that introduced us,
Yes.
I know has kind of been at the forefront of that work at Texas Health and looking at opportunities too. And so, I would love that opportunity, I think, for us to be able to continue that work forward.
Right. There's definitely a need and an opportunity to
Mm-hmm.
collaborate further and serve in the Mansfield community and surrounding cities such as Arlington and Midlothian, Grand Prairie, and so forth. Yeah.
Absolutely. I mean, this whole area is just continuing to grow. So, having this opportunity to sort of test the waters and pilot it, in one area
Right.
that's continuing to grow every day. There's new people moving here. And so, how do we hurry and figure out, how do we best help our neighbors so that everybody has an amazing experience and is able to call this area home?
I sure hope this conversation will stimulate this discussion further, and we'll see what becomes of it.
Mm-hmm.
So you've worked in the community and provided such expertise and have established programs and systems, and now you are strategically positioned at the university to pass on a lot of your experience to the next generation, and they certainly have their unique approaches to addressing needs. They're in a time, they're coming up in a time that's just a lot different from 10, 20 years ago.
Mm-hmm.
They have been traumatized by COVID,
Mm-hmm.
So can we talk about, your experience in the classroom? I know I think that you teach mostly how to establish nonprofits and so forth, right?
Yeah, I do. So yeah, I teach, it's a bachelor's in philanthropy degree at UT Arlington. And it's kind of interesting for me, having gone from one of the most multicultural cities in the world to now one of the most culturally diverse campuses in the world. We really do have an amazing student body at UTA who are passionate about a lot of things. And so I have the opportunity to work with students who are excited about doing something service oriented. And for a lot of them, they just don't really know what that looks like, but they're
Right.
passionate about different things, whether
Right.
that's, they volunteer in their local church, they volunteer on campus in a student organization, or they've worked in different nonprofits. Some of them have worked at summer camps their whole life in different organizations like YMCA. And they really do see themselves, in a way that they want to do that as a career. They want to be able to do that professionally. And so it's super cool for me to figure out, what their passions are and how to kind of help them navigate that world, whether that's from a
And
finance
figuring out their passion.
Yeah, it's
Yeah.
awesome.
Yeah, so I am alumnus of the University of Texas at Arlington, right? And I remember being in a classroom with someone from Bangladesh, from Pakistan, from Syria, from Israel,
Uh-huh.
from the UK, from Africa.
Mm-hmm.
In one classroom, you can find people from so many different countries, different
Yeah.
cultures, and so their perspectives
Mm-hmm.
differ. However, from that classroom can come such a beautiful discussion, because you learn
Yes.
from each other.
Oh, it's so true. And for me, adapting my teaching, this is a learning opportunity for me, is just, as a teacher now, to work with students from a broad kind of spectrum cross-culturally. I last semester was my first full-time semester, and we were using a reference to social movements kind of within the U.S. landscape. And I was talking about George Floyd's death and the social movement,
Right.
Black Lives Matter, and some of the nonprofit and advocacy work that was coming out of all of that. And I had a student from Korea who basically said, she puts up her hand, she said, "I'm so sorry, I don't know what you're talking about." And I was floored because, for me, it's so relevant as part of this conversation, and thinking, these are young people who are going to be very much aware of kind of all of that took place. But, if you weren't living in the United States, it might not have been as prevalent in the news and in the media, especially in a non-English speaking country.
Right. UTA is such a unique place.
Mm-hmm.
And, I try to probe a little here because there's so many things that are happening in the U.S. by itself, so many social challenges, social uprising, and the social media of itself is such an engine that pushes it out.
Mm-hmm.
And so different things are out there. Do you get a pulse of the sensitivity of these students? Are they frustrated? Are they? Are you getting what I'm getting at?
Yeah, I think so. Yeah, definitely.
Yeah.
We actually watched a video that was a fundraising, because I teach a lot of fundraising classes. We watched it was a video, it was a live simulcast that one of the students found on YouTube. He was leading the class that day, and we were talking about great fundraising speeches.
Right.
And this particular video was post Hurricane Harvey a few years ago, which really impacted the Houston area. Mm-hmm. And on this video, you had, it was actually the Bush family, George H., who kind of initiated this through a nonprofit organization that he started called Points of Light. Right. And on the platform, you had so many leaders, Republican and Democrat, past presidents, who were sharing the stage together and really advocating for this cause. And you could see the camaraderie on the stage. Mm-hmm. And it was really special. And we all thought, wow, the speech was really good. We watched George W. Bush speak. We watched Obama speak. And after that, we were talking about, and the fundraising impact, getting people motivated to be able to contribute to this national incident. And so after the fact, it was a very interesting conversation because the students got really kind of cynical. And saying, you would never see that happen again. You would never see, these leaders, these presidents or political parties come together, for a cause, especially at that level, looking at the presidential level.
They think they're pessimistic perhaps about the leadership, but mm-hmm. they want to. There's a desire in this generation to form not-for-profit organizations and contribute to the work mm-hmm. of not-for-profit organizations.
Absolutely. And so I think for them, most of them are looking at grassroots kinds of things, the social causes and the movements that are happening, that they can kind of get their arms around and feel like that they're a part of. And so by a long shot, they are so enthusiastic about the possibilities and things that they can contribute and what they see other organizations doing. Right. I think that there's just this feeling of, I wouldn't say despair, but just this lack of hope or uncertainty of what's going to happen at kind of that, at the national level and, and with things getting politicized very easily. And so I think there's some angst around that. But when it comes to actually being able to serve and see nonprofits do good things and wanting to put themselves in that career space, yeah, they're definitely motivated that way.
You are a strategic place. What a place to be, to influence the young minds. How fulfilling is this? It's amazing. It's amazing.
It's a little challenging at times, but it's amazing.
Yeah. Now, how do you see things going forward for you, Dr. Harris? Being in the classroom and having been in the community, what role do you see yourself playing going forward, perhaps in consultancy or,
Yeah, potentially. One of the favorite things that I get to do is help students connect with a local nonprofit, right. And see them kind of bridge that gap, whether it's service learning projects, internship opportunities. So it's amazing to kind of still have a hand or a foot in both worlds where, I get to kind of live that world with the nonprofit leadership to figure out like what's going on in their world. And then how do I help them for my classes, my classroom and my students, to kind of come alongside them. But, certainly, I've had a lot of other nonprofit leaders reach out and say, gosh, we really can't go back to school full time, but is there something that you could do, maybe a workshop or a course or a tool to be able to help us with something that we're working on? So
I'm glad you said that.
For sure.
I'm glad you said that, because I think there's a need to further train, especially in areas of cultural humility, cultural competence. So there's a need to train these small community organizations, churches and missions that are trying to make an impact. So there needs to be training. There needs to be a system that provides advice on how to establish non-for-profit organizations.
Right.
So there's clearly an opportunity out there, and I know you will have that impact going forward. We have covered so much in this such short space of time, from you leaving Texas to Canada, back to Texas, at UTA teaching. So anything you thought of coming into the interview that we haven't touched on?
Thank you. I mean, I love talking about all of these things and figuring out kind of what the next iteration looks like from my experience to your experience, and continuing to collaborate together. I think, for all of us who have the opportunity just to continue these conversations and look for ways that we can leverage resources. And there's so much good that's happening, for us to get out of our silos sometimes with whatever sector of society that we're working in, to get out of that and have coffee and talk about what's going on, and maybe spark new ideas around collaboration and innovative things that we can do
especially in the Dallas-Fort Worth area here, in Mansfield, and
absolutely
communities.
Absolutely. Yeah, absolutely.
Dr. Harris, I enjoyed this short and good conversation.
Thank you. All the best. Yeah. I wish you well with this project and all of the amazing things that you're doing. Thank you for allowing me to be a part of it.
I appreciate it. Perhaps we'll come back at another time to talk more.
Yes.
Thank you. Thanks for your talk, and have a good evening. I know earlier today we had the wonderful eclipse.
Yes.
And it's something to talk about and reflect on.
Amazing experience, for sure.
Yes.
Thanks for listening to Cultivating Health Equity Stories. Remember, our mission is to amplify voices, challenge norms, and inspire change. Go to cultivatehealthequity.com, sign up on our email list, subscribe for future episodes, and find the resources mentioned in the show notes. Until next time.